Hi, I'm Mabel Jong, and I'm here today with J.S. Walker, and you may know him as the founder of Priceline, and now he's challenging himself with taking on issues in the healthcare industry. Jace, thank you so much for being with us today.
Glad to be here, Mabel.
And now, in terms of being curator of TedMed, you're meeting a lot of smart people who have a lot of things to say about healthcare.
Well, actually, much more than healthcare. Healthcare is really, in America, is a sick care system, not a healthcare system, and sick care is a very small part of health and wellness. So TedMed is the TED conference all about health and wellness, and we just completed it last week here at the Kennedy Center in Washington, D.C. So other than being a little tired, I have 1,500 new friends from the Kennedy Center and about 50,000 watched live in auditoriums all across the United States.
Okay, and some of the things that you talked about were some of the issues really challenging health care and wellness, and it sounds like people still need to work on how they make health choices.
Well, in all fairness, we make health choices every day, about 100 times a day. All the food we eat is a health choice. Our choice of activity level is a health choice. How much sleep we get every night is a health choice. Whether we choose to smoke or drink is a health choice. How we treat our children is a mental health choice. I mean, we're making thousands and thousands of health choices every day. TedMed is a community of people. Instead of just talking about science or doctors or regulators, we're a horizontal community that looks across all of health and wellness by bringing together leaders of all kinds, including the patient community, to talk about, number one, what do we need to understand in order to make better choices and better decisions in being healthy and well? And what do we need to do to improve our own sick care system in the United States, which of course is itself sick?
And we may be able to say that you've been an expert in behavior for some time. But
well, all marketers are experts in behaviors. What's nice about a marketer is a marketer tries to find customers. And anytime you're a business that you find new customers, you're changing people's behavior. They used to buy from one business, and now they buy from another. When you create a product, you're actually changing people's behavior. So consumer marketers, especially people like me who have built businesses of millions and tens of millions of customers, we're used to thinking about how do we get people to behave differently in the way they want to when it's millions and millions of people as opposed to just one?
Why are we still talking about wellness as being a real issue for people? Why can't people just naturally make healthy choices?
Well, because we don't want to, generally. As a general rule, people want to make the choices that they make them feel better now. That's this human thing. Right? They may know that smoking is bad for them, and yet 20% of the population smokes. You may know that a colonoscopy can save your life if it detects cancer early, and yet you may never want a colonoscopy because you're queasy. You may know that 8 hours of sleep is probably one of the best things you can do to lead a healthy life, and yet you're on that plane, you're staying up, you're doing something, and you're sleeping 6 hours. We're humans. We make human choices. We're not brainiacs. We don't make the smartest choices. We make the choices primarily that we think feel best for us. And that's not being critical of who we are. I'm no different than you. I make the choices too. In fact, many people choose to inject the most dangerous poison known to man right into their face so that they don't have wrinkles. I don't know about you, but injecting botulinum poison about 2 centimeters from my brain, that seems like a bad idea.
That seems a bad idea to me too. Yeah. So are conferences like TedMed getting these people to talk about something that we already know? Is that really going to help?
No, actually it's very different. Conferences like TedMed are horizontal. They're bringing together people who are having successes in one or two areas and showing them what those successes might be in other areas. They're demonstrating that teams are the answer, that we're going to not just have scientists or doctors, but we're going to need people from the church and people who are patients and people who are family practitioners. And we're going to have people all together. Together we can create new kinds of innovations, new kinds of systems, not to tell people what they should do, but to make it joyful for people to do the right thing.
Give me an idea of how you can make making healthy choices joyful.
You can make it joyful. If you're a person who's a senior citizen and doesn't like to walk, and you don't want to exercise, and yet literally 15 minutes of walking, your son or daughter might say, Mom, Dad, tell you what, I will come by with the kids every weekend if you agree to walk just 3 times a week with your neighbor, who you like. Just go for a walk 3 times a week and I'll come visit with the kids on the weekend, and then we'll go for a walk together. No, we won't go to the steakhouse together. We're going to go for a walk together. We're going to enjoy each other. Well, that senior might say, that's a fantastic. If you'll visit me more, I'll walk more. Everybody's joyful in that circumstance.
Okay, so really bringing these issues home in a positive and really fun way.
Wellness is local. It's not government. You don't get well at a doctor's. Your body gets you well. You know, the number of people that take a drug to get well are tiny, right? We don't have, cholesterol, high cholesterol in your blood is not a statin deficiency. Okay? The idea that you can take a drug that replaces a healthy lifestyle, that's crazy, Mabel. That's just crazy talk.
You're a delight. Thank you, Jay.
You're very welcome. Thanks for having me.
J.S. Walker of Walker Digital. I'm Mabel Jong.